Welcome to Anatomy with Dr. Jasma. Let's talk about the prostate. So we're using our visible body app here, and we're going to just orient ourselves. There's the seminal vesicle, there's the vas deferens, and then if I can zoom in properly here, all right, that's just showing the prostate. And then the next one, that is the ejaculatory duct into an area called the verumontanum. Now, you don't hear about that body part very often, the verumontanum, but it has an area within that area. It's called the prostatic utricle, and it's just a fold. It's a fold that can hold stuff like urine. And within the verumontanum, you have that's where the ejaculatory ducts come into the prostatic urethra. Normally, the prostatic utricle will fill up with urine, and then you pee, and then the urine comes out, and everything works fine. But for some people who have an enlarged utricle, it can become inflamed, and fluid and spermatic fluid and urine and different things can become entrapped with there and cause a lot of inflammation and epididymolysis because of how the vas deferens comes into that area. And that can lead to testicular pain. There's so many things that can cause testicular pain. Who knew? There is some research out there that people who have hypospadias, and that's just where the exit of the urethra comes out at a different place than where it would typically come out at, tend to have enlarged prostatic utricles. Now, this is a congenital abnormality. It's not something that you did wrong. It's not typically a place that you can get injured at. In general, some surgeries, I guess, could cause some of that, but it is a surgical intervention if that's what's going on. So your urologist would help you out with that. Then if we take this body part off, so we remove the prostate, you can see that it actually rests right here on your pelvic floor muscles. And because of that connection, inflammation of the prostate can cause pelvic floor pain, or pelvic floor muscle spasm can cause inflammation of the prostate. So if you are dealing with prostatitis, and it's not bacterial prostatitis, go see your pelvic floor physical therapist. They can help you. Right there, that's where you find one closest to you. And if you want to learn more about your body and how it works, hit that follow button.